Hi, Dr. Ashley with the Allergy and Asthma Group of Galen. Today I wanted to talk about the basics of stinging insect allergies. Now, when we're talking about stinging insects, we're talking about those insects that use a stinger on their hind side to sting your skin when they come in contact with you. And when they do that, they actually inject their venom in a very, very small amount into you. Now, some people can be allergic to that venom, and that can set off all kinds of symptoms. Usually it happens immediately or within an hour or two at the most, and it can range from a few hives here and there, to swelling of the eyelids, swelling of the throat, shortness of breath, vomiting, low blood pressure, and even death. These can be deadly venom allergies to these insects. The ones we typically are following here in the United States are two types of hornets, wasps, yellow jackets, honeybees, and fire ants. A lot of people ask about mosquitoes. We've made another video on mosquito allergies. Yes, they do exist, but they're not deadly because they don't inject a venom into you, such as these other insects do. If we find through your story and our allergy test that you are allergic to one of these flying stinging insect venoms, it can be dangerous for you if or when you are stung again. And our literature points out that it's probably a 50-50 shot whether you may have a serious reaction during stings that happen again in your future. So say you are allergic to a honeybee, and we determine that based on some symptoms you've had in the past after a sting and our tests coming back positive. Well, if you get stung by a honeybee again in the future, it's a coin flip whether nothing happens at all or a full body reaction occurs. And that's why we really, in the allergy and immunology world, consider our venom desensitizations life-saving. That's where we literally take these venoms, which have been purified, and we start at a very small dose and give you a shot of them once a week, or actually you could even do it more than that if you want to speed up the process. But we start at really low amounts and inject it into your skin over time until we reach a high amount, and that teaches your body not to react to these venoms if you're stung again. In fact, it can decrease that risk from a 50-50 shot of a reaction when you're stung again down to less than 2%. And so it makes a world of difference in patients' lives and can even be life-saving for those with venom allergies. It's one of the few things we really push for as far as allergy shots when we find these venoms, because they can save lives. A lot of people don't even know that we can desensitize patients to insects they are allergic to. If you or one of your loved ones or friends have an allergy to a stinging insect, please come in and see us at the Allergy and Asthma Group of Galen, and we will help determine if this story is consistent with an allergy, do testing, and even talk about these allergy shots with you. Take care.